Good afternoon, and thank you all for joining. We'll be starting right at the top of the hour. Look forward to talking to you all soon. Hello, everybody. Thank you for joining. We have a lot of people joining today. We're excited about this webinar. We're going to start at the top of the hour in about 2 minutes, so stand by. Thank you. Hello, folks. Just so everybody knows, we are obviously we are controlling microphones, so no one can speak, but we are not controlling audio, so you should be able to hear us from our end. If you cannot hear us, it's probably likely an issue on your end. Perfect. All right, folks. Well, hello, and thank you for joining. We will begin the presentation. We appreciate you being here, and thank you all for joining us for today's webinar on the physical environment compliance. Today, we plan on spending a little time on the new Joint Commission standards and what they look like moving into 2026. But we also want to plan on spending some time on giving you some tools and ways to improve your process, not only for compliance, but also to keep your organization safe. We have an exciting and full workshop and look forward to sharing our ideas with you. Couple of housekeeping issues. If you have any questions or comments, please feel free to use the chat feature of Teams. We will be monitoring the chat throughout the program, but we'll address all the questions at the end. But don't worry, if we don't have time for all the questions, we will follow up with a Q&A document to all attendees. So if everybody's good with that, we're going to get started. First slide, please. This is just our standard disclaimer. We'll move on to the next slide. Thank you. There we go. Perfect. A little bit about Jensen Hughes. First of all, we appreciate you being here and we welcome you to this important webinar. And as healthcare leaders, you know that staying ahead of compliance isn't just about passing a survey. It's about protecting patients and your organization every day. We here at Jensen Hughes have that same philosophy about keeping our world safe, secure, and resilient. And we have our purpose and principles to keep us grounded, valuing our people, our clients, and advancing our industry. Jensen, next slide, please. A little bit about Jensen Hughes. Jensen Hughes is a global partner in engineering, consulting, and technology with over 100 offices across the globe in over 100 countries with over 1,800 employees. But we also have a core group dedicated specifically to healthcare compliance, providing solutions for life safety, fire safety, the physical environment, and emergency management, serving over 1,800 organizations annually. And the good news is that despite being so big and having such diversity of capabilities, our healthcare staff are located all across the country, providing local presence for everything from one-time mock surveys to life safety assessments to annual partnerships, building healthcare compliance and safety programs. Next slide, please. Hey, my name is Nick Gabriel, and I'm glad to be here with you today. I'll be your moderator. You're going to be getting rid of me pretty quickly, but I'm proud to be joined by three of my friends and colleagues. Herman McKenzie, currently leading HMK Healthcare and former director of the Standards Interpretation Group at the Joint Commission. Paul Zorinda, a senior consultant here at Jensen Hughes and our Life Safety Code service line leader. And Colin McKay, also a senior consultant here at Jensen Hughes and a service line leader overseeing many of our healthcare compliance offerings. Now, next slide, please. Before we dive into the details with those guys, I want to provide a quick overview on what you probably already know, right? The Joint Commission has restructured its accreditation standards through the new Accreditation 360 framework. Herman is going to be going into some of the details on the history of Accreditation 360, but the headlines are this. One, it's effective January 1st, 2026, the new standards. One of the major goals was alignment with the CMS conditions of participation and to reduce standards, and they did so by over 50%. In the process, they created national performance goals, which is its own chapter, which elevates selected items, but there's really nothing new here, just reiterations of existing standards. Another goal was increasing transparency. So standards, Joint Commission standards, are now available to the public. They have a great website with a lot of tools. They've also published a survey process guide that Paul will talk about later. Really takes the mystery out of what a survey is. And there's a continued emphasis on process and meeting the goals of the standards versus reiterating prescriptive requirements that are found in other codes and standards. Next slide, please. This webinar is really going to focus on what we consider to be one of the most significant updates, the integration of the environment of care and life safety chapters into a single unified chapter called the physical environment. Key takeaway, almost everything that was in there is still there. Some may appear less specific or combined, but with few exceptions, organizations are still responsible for the same requirements. They just may look different or have moved. So when you look at the new standards, you'll find that most of the standards are either in the physical environment chapter, where they've been revised, consolidated, or just moved there, or they've been moved to the National Performance Goals, or the NPG chapter, or they've been moved to guidance in the survey process guide and all the tools that are associated there. Don't be fooled. Reduced specificity does not reduce requirements. It's really up to you and your organization to know and understand the details of all the codes, all the reference codes and standards, and to develop processes to assure compliance. Next slide, please. Really, almost everything that was in life safety and environmental care are now in these 8 physical environment standards and these 4 NPG standards. And finally, my last slide. With that, we'll get started. Paul is going to kick us off with the focus on life safety compliance. Next slide, please. Paul's going to start out with a focus on life safety compliance. Colin will then discuss overall building safety and facility management. And then Herman is going to bring us home with a history of Accreditation 360 and some highlights of some of the other changes. With that, I'm going to turn it over to my buddy Paul.
All right, great. Thanks, Nick. So with that in mind, next slide, please. With that in mind, Nick gave that great overview of Accreditation 360 and the consolidation and so on and so forth. Now, what I want to do is spend some time focusing on the life safety standard component of that. And the first thing I'd like to mention is, and maybe this will put your mind at ease a little bit, is that there are no new requirements from a life safety code standpoint. So let that sink in for a minute. Think about that. No new requirements. The requirement remains that you still need to comply with the 2012 Life Safety Code, right? It's been like that since 2016 when CMS, the federal government, adopted that standard or that code. And that's what we have to live by since 2016. So here we are. Just a quick sidebar for some of you that might not deal with life safety code all the time, or you might be wondering, why is Paul telling me I have to comply with the 2012 life safety code? Isn't it 2025? And the answer to that question is yes. It's not a typo on our screen. It just so happens that that is the edition, 2012, that CMS adopted and enforces to this day. At some point, we would imagine that a more current edition of that will be adopted. We just don't know when that will be. That's anybody's guess right now. Okay, so after that sidebar, quick back to the Joint Commission requirements now and the consolidation. So what Joint Commission did from a life safety chapter and standards perspective is they drastically consolidated. They went from maybe 25 or 30 life safety standards with over 200 EPs, elements of performance, and dropped that down to 2 standards and 24 EPs. So obviously, do the math there, drastic consolidation. And along with that, of course, inherently comes less detail. So what I mean by that is, the standards aren't going to be as specific or the EPs as they were with the current arrangement. One example, because we've gotten some questions on this, and we've been following some of the social medias, and I know this has come up a couple times. One example amongst many is in the current EPs for life safety, Joint Commission specifically says that in timeframes set by the organization, you have to assess your building for life safety code compliance. Well, in the new standards, in the new life safety standard, you will not see that exact language. However, what you will see is a very generic statement that says you need to meet the 2012 life safety code, like I said, right? What you need to do is you need to have the wherewithal and the understanding to know that when you reference the life safety code, then you'll see sections in the core chapters, the beginning chapters, that talk about maintenance. If you have fire protection features in your building, you have to maintain them. So that's where you'll find pieces like that have changed. Essentially, long story short, yes, less detail. I mentioned that. However, the expectations still remain high. You need to comply with the life safety code at all times, not just during survey week or survey day, but at all times. Next slide, please. So you might be wondering, okay, consolidated standards by the Joint Commission, how do I comply? What do I have to do? And I wish I had a magic potion or a magic answer to give you, but we all know it's more complex than that. However, what I would offer is maybe a challenge or an encouragement, I guess we'll call it. I would encourage you to look at the processes that you have in place right now for managing your life safety code compliance, and seeing where you might be able to improve those and strengthen those to make sure you have compliance at all times. And what we've seen, the processes that I'm going to be talking about over the next couple of slides, is knowing the codes and standards, knowing your building, assessing your building, and repairing your building. And I'll talk about each of those in the upcoming slides. Next, please. All right, so first and foremost, look at your processes, analyze your processes for how you know the codes and standards. Sounds pretty basic, right? And easy, but it's not. It's actually deeply involved, of course. So look at how your organization or your team knows the codes and standards, the rule book that you need to comply with. Do you have internal teams? Many of our larger clients do, and then they'll partner with us as well. Do you rely strictly on a third party, or do you rely strictly on your internal teams? So take a look at the processes that you use to know the codes and standards. And then really quick, because it's very, very important, but don't forget about Chapter 2 of the Life Safety Code, because Chapter 2 talks about reference publications. And if you look at that chapter, you will see dozens and dozens of reference codes that also might need to be complied with, maybe in their entirety, maybe just pieces, but you really want to look at those. Examples: NFPA 10 for extinguishers, 13 sprinklers, NFPA 20 for fire pumps, and the list goes on and on and on. But making sure that you know what applies to your situation and to your building, and what applies retroactively versus what would only apply during a new renovation or construction. That's exercising smart compliance. Use your resources. So the Joint Commission, in my opinion, did a great job when they released the Physical Environment Standards and Accreditation 360. And they released documents that are there to help you and there to describe the process. One of them being the Survey Process Guide. And this was currently, as we sit today, known as the Survey Activity Guide. So slight change there, again, focusing on the process. So the Survey Process Guide, SPG, this is a document that is over 600 pages long. It sets the expectations. It sets the pace for how a survey will go, what the surveyors will look for, documentation that required, and so on and so forth. So familiarize yourself with this document if you haven't already. One key piece to the SPG that is specifically called out by the Joint Commission is to know your construction type. What I mean by that is, speaking again from a life safety code standpoint, is know if you're building, what type of building construction type your buildings have. We're not going to go into full detail here. We could talk about this for hours, but in a nutshell, there's levels or types 1 through 5, with type 1 being the most fire resistive, so your concrete structures, to type 5 being the least fire protective, for example, like your wood frame buildings. So look at your drawings, look at your as-built. I know it's very challenging, if you have a building that's 50, 60, 70 years old or older, but you do want to ascertain and find out what the construction type is. And then another great tool here is the Life Safety Code and the HCFC evaluation tool. HCFC is just another fancy way of saying NFPA 99. And Colin will talk about that here in a couple slides. But this checklist here shows many, and I want to stress many, but not all, life safety code requirements. It's a great checklist. It shows the PE standard and how that coincides or corresponds to CMS's K tag. So it's a great document. However, keep in mind, this is not the entire life safety code. So you still need to make sure that you're very familiar with the life safety code. One example amongst many, just to kind of set the pace, is if you look at this checklist, you'll see that it'll mention door locking, and it'll provide some requirements there, but however, it does not provide every single requirement. For example, if you want to use delayed egress locking, access control, locking for clinical needs, whatever the case might be, you still need to reference the life safety code to get all the specifics and make sure that you're applying those appropriately. Next slide, please. All right, the next process to look at is, how do you know your building? And what I mean by that from a life safety code standpoint is, what are your occupancy types? Is it existing or new healthcare, existing or new ambulatory, business? There's others, but those are the primary ones we deal with. What are your occupancy types? Knowing those, and then knowing what fire protection features you have in place also. Do you have rated barriers and smoke barriers? Venture to say you probably do. Sprinklers, fire alarm systems, so on and so forth. Know what you have, because obviously, like I mentioned a few slides back, if you have them, you have to maintain them. And of course, this all kind of wraps up into a very, very important document or drawing, is having accurate life safety drawings. And we'll show a drawing on the next slide going into a little more detail, but make sure that you have accurate life safety drawings. And one area where we see some of our clients stumble or are challenged, and I get it, it's not easy to do, is making sure that the life safety drawings are a living document. So you renovate an area, you change the use of an area, whatever the case might be. If you renovate or you change it, make sure that your life safety drawings are revised and that it's a living document and is in a constant state of accuracy. And then last but not least, take a look at your outpatient sites too. All right, let that sink in for a minute, because some of you might have heard, some of you might have not, but Joint Commission released information maybe 2 months ago that they are going to start going to outpatient sites as well. And in those cases, many times, but not always, the business or the occupancy type is business occupancy. So you need to know that that applies and different rules and regulations. Next slide, please. This is just a brief slide. I'm not going to go over every bullet point, but this is just an example of a life safety drawing that we provide to our clients. Your drawings do not have to look like this. This don't have to have the same shading, the same legends and so on and so forth. This is just an example. However, what I would encourage you to do is when we send the slides out, to take a look at the bullet points they have on the right-hand side there and see how your drawings match up and where you might need to make some improvements, if any. Next slide, please. So again, how do you comply? I would recommend or encourage that you take a look at how you assess your buildings. A couple different ways to do this. First and foremost, you can do full life safety code assessments. These are what we do day in and day out, but looking at your building from a top to bottom, left to right approach, and trying to get in every nook and cranny of the building, every room within the building where practical, and see how you measure up against life safety code compliance. Again, that could be internal teams that do it, partnered with external third parties to provide an unbiased eye, whatever the case is. Internal rounding, I would guess that most of you, if not all of you, have internal rounding teams, EOC rounds, grand rounds, safety rounds, whatever you call them, where you can also look at life safety code compliance. And then last but not least, but also look at your staff and use your staff. So maybe clinical staff, they're there day in and day out. Educate them and empower them to look for life safety code deficiencies as well. Maybe exit doors are blocked or wedged open. Maybe there's corridor clutter, items like that the clinical staff can look at. And again, don't forget your outpatient sites. Do some assessments and have an understanding of those as well. Next slide. All right. We talked about assessing your building. Now, where one of the prime challenges or more fun happens is in actually repairing your building. So you assessed, you've got this list. Now you need to fix these items. Well, take a look at how you fix those items and how you prioritize that. Obviously, budgets are extremely tight right now, and funding is not unlimited. So you can't fix the world in one day. So look at your deficiency reports and take a look at how you prioritize them. Areas such as an ICU, surgery, those will get more scrutiny, and you should spend your time and energy and money on those areas versus maybe an office down the hallway that is used for an administrator or a supervisor. So take a look at that and look how you fix these items and how you close the loop. And what I mean by closing the loop is truly fixing the deficiency. So many times, well, not many times, but sometimes we'll do a full life safety assessment and then we'll come in maybe 6 months later or a year later and look at the completeness of those deficiencies. And sometimes we'll find that it's indicated that it was completed. However, the deficiency was not truly completed and the item still remains. So, partner with your third parties or your internal team and make sure before you fix an item that what you're going to do is truly fixing it, so you're not chasing your tail. Last slide. Thanks. And then last but not least, look at your process for continuous improvement of life safety code compliance. Use your data, CMMS, work order systems, other software systems, spreadsheets, whatever it is, to get an idea of the areas that need more attention and focus. Maybe there's a door to dock areas or kitchen areas that is just constantly getting beat up. Look at that and really dig down to the process and find out why it's happening. And if needed, educate the people in that area to allow them to understand the criticality of why that door needs to operate. And then also do some QA/QC of your internal processes as well. Maybe you have preventative maintenance work orders that come out, on a monthly basis or weekly basis, whatever, to check fire doors. Well, look at the completed work orders from those and making sure that they're accurate. An example, I was recently at a site and I did just that. I was looking at their documents for a monthly fire door inspection that came out, and I looked at the history over the last 6 months to a year, and every single time, every single door passed. There was never a failure. So, and I know that there were failures because I had just walked the building, an hour or two before that. So make sure that the PM work orders are being filled out and the items are being completed appropriately. And then last but not least, before I turn it over to Colin, is develop a strong management of change process. This is critical. If you're making any changes to your areas, make sure that all the teams at your site are involved. For example, security. We all know security is extremely important and needed these days. But if you're going to start locking doors, make sure that security is talking to facility and to make sure that all the life safety code rules and provisions are being followed. So again, higher level life safety code overview. Going to turn it over to Colin now. He's going to talk about the building standard under the PE.
Thanks, Paul. So let's step into the next standard here for building safety and facility management. Looking at EP1, it's a pretty general statement. The hospital complies with NFPA 99, the 2012 edition. Why is that there? Don't we know that? Well, CMS specifically instructed Joint Commission to include this statement because across the entire country, there's a bunch of different authorities having jurisdiction and a variety of different editions of NFPA 99, the Healthcare Facilities Code, that could be referenced in any other specific requirements. So specifically, the 2012 edition is the one identified for the Joint Commission. It's a risk-based standard, and basically, what does that really mean? That means, have we assessed our building and our patients at the category of risk that they're up against for these systems? So, if the electrical system or a component of the electrical system failed, what would be the outcome for the patient? Would it be catastrophic? Would there be significant injury or death? Well, that's a category 1, and we need to treat that category 1 system and maintain it as such in NFPA 99. So each of your systems at new construction need to be assessed for this risk and categorized and then maintained therein. What we often find during our various walkthroughs or mock surveys or assessments, conversations with our facilities, has there been a change that the facility staff were not aware of? Are they doing something differently in the clinical space that they weren't that space or that system was not designed for? That's where these really become impactful. So if there's now a new process, a new clinical practice, that system should be reassessed for risk to the patient. So it's not just at new installation, it's constantly evolving. If there's changes occurring within the building, construction, renovation, those are kind of easy, but it's the change in clinical practices or clinical process that goes on within the facilities that you really only start to find out about when you're walking it. There's only one EP for all of these requirements within NFPA 99, the EP1. So where do we go to get some more information? Well, within the survey process guide that Paul was alluding to earlier, it outlines and kind of crosswalks the CMS K tags for NFPA 99. So K tag K900 through 933, those are outlined in the survey process guide, and kind of gives you a playlist, a checklist of things to look for while you're out there and looking. Some examples include medical gas maintenance and testing and all the associated maintenance that goes on with medical gas systems, electrical equipment use and storage and maintenance. So your emergency generators, all your electrical components, those have to be tested and maintained. You'll find that within EP1 here. Also, OR, operating room fire prevention, education and training for new staff, and then continuing education thereafter. None of this is new. This is all things that you should be familiar with if you're Joint Commission accredited. This is nothing new coming at you here. Simply all of these different EPs that we're familiar with, the ECO 203, 020507 for generators, all those different things were combined into this one EP. It makes it a little bit more difficult to find exactly what you need to do, but that survey process guide is significantly beneficial. It outlines some things for you, and you're able to follow it that way. All right, next slide, Aaron. EP2 is that the hospital maintains essential equipment. So we're going quickly now, right? One slide for a ton of information. Here's the second slide for a whole lot of information as well. So this previously was found in ECO 20305. This is your ITM for sprinklers, fire pumps, fire alarm systems, all those components of the fire protection system are found within EP2, the hospital maintains essential equipment. What you won't find currently in any of the survey process guides or any of the documentation are the time thresholds and grace periods that were in the previous standards. They were outlined in the EC, early in the EC chapter. That's weekly, monthly, quarterly, annually, you know, that grace period, the plus or minus 30 days, plus or minus 10 days, etc. Those are still present and are still acceptable. Those are still consistent with the previous standards. They're just not specifically outlined in there currently. Next slide, Aaron. So how can this help us? Well, we need to maintain our essential equipment. We used to have a pretty good document inspection checklist, you know, kind of preparedness tool, right? You still have that available to you in the survey process guide. It's just way down in the bowels of the pages. It's a 800 plus document, and it's in the mid 400s area. You'll see outlined the different types of tests. This chart looks very similar to what was present in the survey readiness tool earlier in previous editions. EP2, 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 EP2. You can see it's all kind of bundled under the same EP, and it outlines exactly what we need to do. The one thing we're going to see differently in this table that wasn't there before is we need to also inspect our systems to NFPA 72, the 2010 edition, table 1445, or NFPA 25, the 2011 edition, table 5112. What are those? 72 is the fire alarm standard, and that's how you're going to maintain your fire alarm systems. And NFPA 25 is water-based fire protection systems. So let's go to table 5112 and see what that looks like. Aaron, next slide, please. So 5112 is broken down in a couple different sections. You see I have inspection highlighted here. This is the inspection portion of this table where we need to do inspection of these various systems. Now, you won't find any of these in the previous EPs that we're familiar using, right? There's just a ton of information within these tables that that the Joint Commission just didn't put into the actual EPs previously. So essentially, we're getting reduced number of EPs, and it essentially opens this up to survey. Now, I'm not telling you right now that surveyors are going out and identifying all these different systems, and you're not, you know, performing inspection quarterly on your water flow alarm devices. You're not going and performing a visual inspection, but this is part of, you know, it's open for review now, essentially. Since there's no specific EP that outlines it, this table, this document really becomes available to against survey. Here we've got a yellow star. This is for control valves. We have to go to a different table to identify how we need to maintain and inspect our control valves, our tamper switches. So having a copy of NFPA 25, the 2011 edition, that's the reference standard that Paul talked about earlier, the reference standard from 101, the 2012 edition. Having a copy of the standard is critically important to understand the different systems you have in your building and how to maintain it. So this is the inspection table. If we go to the next slide, we'll jump into the test table. So now we have a bunch of different systems. We were inspecting it at a certain frequency. Now we need to actually test it. So we need to inspect our water flow devices quarterly. Now, if we look here and we see test, we need to test our vane and pressure switch type devices semi-annually. So this is how these things kind of crosswalk together. This is the EP that we're going to see in the document review tool that we can kind of provide that checklist for. But again, you have a ton of different systems throughout your facilities, and there's a bunch of different devices that could be subject to inspection or to test. So having a copy of this document is critically important here. All right, next slide here, Aaron, please. So as we're testing this equipment, we need to include all the same information we were doing before. Nothing's changed here. Nothing is new. We're kind of looking at this from a new emphasis, though. So you're still providing all the essential details that you used to have in your documentation. Nothing is different there. Do we need to reference this standard when we get to our binders? Yeah, eventually you probably want to make that switch, right? You want to take your binders to reflect exactly what standard you're holding them against. But most importantly is having the accurate NFPA standard, including the year and the edition that you're inspecting that equipment against, and the result of the activity. The result of the activity is more important than what it says on the outside of your binder. What happened when you tested that equipment? Did it pass? And what does a pass actually mean? Right? So kind of outlining, we held it against this criteria and it passed all that criteria. If it didn't, then you want to, I'll go into that in the next slide here. But it's important that all the buildings and properties associated with your accreditation number, UCCN, that are surveyable are incorporated here, and you're accounting for those additional locations. So Paul alluded to the surveyor, life safety surveyor is going to these offsite locations. That is happening. They are not immediately looking for this documentation, but this is absolutely surveyable information. So if you have some sort of third party or some other entity that's looking at this, looking at these locations, make sure that you can receive and review this information just as it would be for your, connected hospital. All right, Aaron, next slide. So what are we really looking for here? Well, you want to have a strong process for ITM, process, right? So having an accurate device inventory, knowing what you have available to you, and knowing where the differences are. So if you had 35 detectors last test, did you have 35 this time? If you didn't, what happened? Did you get rid of some because of construction, or did you add more because you changed the space? So knowing and having an accurate device inventory and knowing and being able to speak to the differences across the several years and iterations that you're performing these tests. Can you prove that failures were corrected? And this kind of goes to that closed loop logo right there, right? You tested the equipment, it didn't pass, some sort of measure was taken, there was a repair made, it was retested to ensure that that repair actually fixed it, and then we can close the loop that way. In the meantime, did you have an ILSM implemented? Did you review it against your ILSM policy for having, for requiring any kind of measure? So knowing what did you pass or fail? All right, it failed. In the meantime, before we get it fixed, we've done a risk assessment. No measures are needed based on our policy, and we're going to document all that, keep all that information available to you. And knowing where that information is held and how to get to it. A lot of times we see that there's one person that knows where all this stuff is kept, right? What happens if they go on vacation, or God forbid they leave the position and go to somewhere else? Have someone else be able to retrieve that information and know where it is. Having electronic record keeping is critical. That way, if it's not physically at the location, it's somewhere. We can go get it from the cloud or whatever backup measures you have. Being able to speak to this information is critical here. All right, next slide, Aaron. All right, I'm going to turn it over to Herman, where he's going to bring us home, give us some insights for what we can do going forward here.
Nick, Paul, Colin, thank you very much. Next slide, please. All right, so I'm going to give you a little inside baseball on how we got to where we are. In 2022, Dr. Perlin arrived at the Joint Commission, and he established an enterprise priority to reduce the amount of standards and elements of performance that were not tied to conditions of participation. And so our research department, well, my previous employer's research department sent out the least scored EPs. And there were some questions that were sent to folks who were asked to review it. And so one of them were, are organizations already compliant while we're not being scored? Do our surveyors, are they comfortable, evaluating these? And if they were reduced or eliminated, would safety be compromised? And so after that first tranche and first go around in 2022 and 2023, interesting enough, there were several that were already eliminated. Interesting, this time of year, the Joint Commission has what its annual hospital executive briefing. And actually at that hospital executive briefing in 2022 is when Dr. Perlin made the first announcement to healthcare organizations that the Joint Commission indeed was removing a lot of these requirements. Next slide, please. All right. So just for a reminder, or maybe this is new information, the Joint Commission acts as, and I'm going to use the terminology, agent for CMS. But this is not something that's done in perpetuity. The Joint Commission or Joint Commission has to apply for deeming authority. Coincidentally, in 2022, Joint Commission was reapplying for deeming authority for critical access hospitals and for hospital programs shortly thereafter. Now, part of this process of applying for deeming authority involves CMS reviewing all the standards and elements of performance. So this was a great time, since they're going to be reviewing anyway, to make the change. All right. Also, coincidentally, I think it was 2022 or 2023, CMS sent out a letter to all accrediting organizations mandating that their requirements more closely match those of CMS. So this was just a great time to make wholesale changes. Another thing was, the enterprise priority was to go from less guard dog to more guide dog. So let's remove things that just weren't required from a COP standpoint. Next slide. All right. So you'll notice, I'm sure everyone's taken a look, there are no more management plans, right? So the proof was the compliance in the building tour and the review of documentation and maintenance. So management plans are great. So let me not discount that. But one of the things you can find is that management plans can be aspirational and not necessarily reflect what's actually happening in operations. And so the emphasis was in keeping in mind and in keeping in line with removing things that are not dictated by COPs, which management plans weren't, was to focus on the building tour and the mandatory inspection, testing, and maintenance documentation. Now, if you haven't heard it already, or if you haven't noticed, I'm going to reiterate what my colleagues have talked about. Go to the SPG, the Survey Process Guide. Now, previously, the Joint Commission had the Survey Activity Guide. It serves the same purpose, but the terminology has changed. It is the Survey Process Guide. You will have the Survey Process Guide the same as a life safety code surveyor will be carrying. So make sure that you follow that. What lacks the specificity that may be lacking in an actual standard or an element of performance, you will find the details in the Survey Process Guide. Next slide, please. All right, so let's talk about a couple of these, right? NPG, National Performance Goal, 1111 EP1, control access to and from security sensitive areas. All right, This is a little bit different than the life safety code requirement, right? Life safety code talks about the proper locking arrangements. This is more on security process. You must have a process for identifying security sensitive areas. And even if it's not a security sensitive areas, you can expect that, part of the maintaining the physical environment under the old terminology environment of care, there is a requirement to make sure that the occupants of the building are kept safe and secure. And so all security related elements of performance will fall under this National Performance Code. Next slide, please. So I'm giving you a list this is for your reference, NPG 11111 EP3. Now, I just mentioned a few moments earlier that, the management plans are no longer there, right? However, there has always been a requirement to have a quality assurance and performance improvement process. Under the clinical auspices, they're used to this term QAPI. So if you talk to your clinical colleagues, they'll say, oh yeah, QAPI. So what's QAPI for the physical environment? And that is a way to make sure that you are monitoring your processes and not just monitoring it, but acting upon any of these incidents. So while the management plans have gone away, this has traditionally been the part of the corollary to the management plans. You've put your plan in place, you're monitoring, you're gathering data, and you're acting on that data. And so you can see it hits the sub points in here, hitting all the aspects or the elements of the old environment of care. And so my tip, you must consider reporting these to the safety committee. There is a great emphasis on making sure the governing body is responsible or is knowledgeable for all the activities that's going on in a healthcare facility. And so one of the ways to make sure that that's happening is have some type of, baking this into your program, that you're always reporting this to a safety committee, because that usually comes under or ends up reporting to the quality section of the board of directors. Next slide. All right. This is a continuation of the EP that I just talked about. And what I want to bring to your attention is these notes, right? Note, and I have some of the text highlighted about all incidents and issues above may be reported to staff in a quality assessment improvement or other functions. So that's that QAPI, issue terminology that I used. All right. This may be back injuries, thefts, all the other things that we covered in the previous slide that cover the old environment of care. Actually, so we're still going to consider the environment of care until January 1. Now, just another reminder, the notes in an EP, they're not to be ignored. They're not the thou shall, but they contain explanatory information for meeting the intent of the element of performance. So, one of the things at Joint Commission is whenever there's, an element of performance or requirement that may need extra information, there's always the intent to make sure that it's understandable to accredited organizations, and that's contained in the notes. Next slide, please. All right, so this is a couple old to new or new to old. PE 111, physical environment properly arranged. This is the old 261. Boy, this was one of the top 10 every year, right? And that's usually stained ceiling tiles, broken furniture, and unkempt spaces. You've heard earlier in this presentation how, doing periodic rounds, while they are not required by the Joint Commission, having some type of rounds or environment of care rounds, checking out spaces, you can get ahead of this. Another thing that I like to point out, this is under the physical environment, but many of these, I'm comfortable saying most of these are scored by clinical folks, because the clinical folks are the ones that have walked the halls. They've looked at left and right. They're not just in mostly, predominantly mechanical spaces. They're on the front of the house, right? Whereas some of us who've worked in facilities and support are in the back of the house. And so you have a lot of this scored by clinical folks. And so we don't want these to add up. Next slide, please. All right, here's another one. Excuse me, hazardous materials and waste, right? The old was under EC 221. It's moved to PE 211. Give you a tip. Any waste hauler out there is going to be willing to train your staff to provide the Department of Transportation training. They do it as part of, they do it, as part of their agreement with you, and they are more than welcome to help you out. Also, just as a reminder, you need to have your safety data sheets. You should have them in duplicate in two areas. Number one, where the specific chemical or item used, and number two, in an area that's monitored 24/7. Next slide. All right, here's another one. It once was under, or currently, 252, EC 252, Environment of Care, and it's being moved to 415. I can tell you some of the top things that you find is either no plan, no diagram, which is a requirement, or an organization puts things in their policy that they're not complying with. All right. And so you want to make sure that you follow the requirements of your plan. There's no need to exceed it unless you know that you're going to follow it. And also, this is another one that is highly scored by clinical staff as opposed to only being focused on by life safety code surveyors. Actually, the infection control team at the Joint Commission was very integral in putting this standard together several years ago. So keep that in mind. This is not something that's just the province of the life safety code surveyor. You can expect that clinical surveyors will be looking at this as well. Next slide. All right. Workplace violence program. All right. Now, one of the things if you have not noticed, there are certain things that are moved to NPG, the National Performance Goal. These predominantly are not tied to NFPA code. They may have a condition of participation. There may be a link to condition of participation broadly in using a broad interpretation, but these generally are not tied to NFPA code. However, in going through and developing Accreditation 360, it made sense. Remember, I told you one of the things when in eliminating the redundant or the extra standards in EPs was, will it affect safety? Well, there are some things that did affect safety, although it wasn't mandated by a COP or NFPA code. Now, workplace violence program. That's a highly visible thing in the United States to make sure that the subject of, folks who work in healthcare are experiencing a lot of violence. And so this was put in place. This was put in place in 2022, if I could recollect, properly. And so you've had a couple years to put processes in place. One of the things to look for, once you have your workplace violence program, one of the requirements is an annual review. Do your annual review. And if you're seeing things that require action, make sure that there's a trail that you're closing the loop, as previously mentioned. If you're finding something, you're finding a deficiency, you're finding a negative trend, it's not enough just to identify it, but to take action steps to correct it. Next slide. All right. This is my last slide. I know you have a lot of questions for us. I'm going to leave you some time to answer those questions. So you have imaging staff training is another national performance goal, 1311, and imaging performance evaluation. That's more of the equipment, PE 511. Make sure in terms of the staff education, make sure you identify someone accountable for making sure that education and training records are current and accurate. Folks at the central office will receive questions about the imaging staff training and safety risk. So make sure that you have this, stay ahead of the game, make sure that this is an open book, test, so to speak, right? You have the survey process guide, you have educational programs such as this. Please take advantage of it and make sure that you will maintain compliance. And with that, I'm going to turn it over to my colleagues for any questions you may have.
Thanks, Herman. That was great. Appreciate it. I appreciate the inside baseball comment. Obviously bring a lot of history and detail to this discussion. So appreciate you being here with us. And we're not going to let you get away with that easy. The first question is right out of the gate coming to you, and it's been one that has been asked probably in about 6 different ways by 6 different people. But the question generally is, as you look at these changes, is the safer matrix scoring going to be revisited? Since the standards were consolidated, it seems that there will be more condition level findings potentially scored during surveys because of the broad brush of many of these standards. So you want to take that one on?
Sure. Great question. Dr. Perlin has been very emphatic in saying he wants to, as an enterprise goal, reduce redundant and unnecessary standards and requirements and make the accreditation process more fruitful. So I would say the Joint Commission would not want to have more condition level surveys. I think that would kind of contradict the purpose of why would you go through all this process to go to accreditation 360 to make it more understandable and easier, and then accredited organizations just can't meet the requirements. So that's my take on it.
Thank you. That makes perfect sense. And I guess we'll wait and see, but that's great insight. Appreciate it. Paul, next one is for you. You mentioned the need for continual life safety assessments. If I have a new building built to current codes, do I still need to focus on this?
Oh boy, do we have an hour to talk about this one? Or yes, of course you do. That's a great question. When it comes to life safety code compliance, knowing your occupancy type is so critical. Like I mentioned, knowing if it's existing, knowing if it's new, and then knowing which rules and requirements apply. And I'll keep it short and sweet, but if I could recommend, look at this in the design stages. So if you have a construction project renovation going on, make sure that you're looking at the design drawings and you can catch many of the life safety code issues or deficiencies before hammers start swinging. And that way you can catch it in the early stage and it doesn't occur.
Appreciate that. And a follow-up question that's maybe a little specific, but I think it brings up a great point. The specific question had to do with the definition of the gross area of a smoke compartment in the newer editions of the Life Safety Code versus the 2012 edition. And the question is, what is your take on this issue? As I see in the industry, a little bit of confusion about applying the 2021 edition while trying to use the 2012 edition to meet the CMS Joint Commission Accrediting Organization guidelines.
Yeah, so that's a great question, and I saw that one come through. And we as a
Don't
firm
be afraid to be blunt, Paul. Say it the way it is.
Yep, we did see that. We have wrestled with this or thought about this one internally within our firm also, and I guess long story short, kind of unofficially, we're not an AHJ obviously, but it seemed that in 2012 that definition is not crystal clear, and it was clarified in later editions of the code. So it seems reasonable, and we've seen it applied to use that newer definition in the newer edition for your projects now, even though 2021-24 edition is not applied in its entirety.
Appreciate it. Great. Colin, next one is for you. Is the Joint Commission evaluation of outpatient medical office building facilities driven by CMS regs in any way, or is this a type of ad service from the Joint Commission?
No, it's anything that's incorporated underneath that surveyable umbrella. That's part of the locations that you list in the EBBI. It's why it's important to have it accurate and specific. To ensure that whatever locations are there, they're open for review. But you only apply the appropriate occupancy chapter from NFPA 101 that applies to that building. So if it's a medical office building, it's probably business. So you're going to focus on the business occupancy requirements therein, but not the healthcare requirements because it's not healthcare.
Got it. You know, I appreciate that. And I think it's important to mention too that that's really not a change. The offsite locations have always been required to meet the life safety code. They just traditionally were surveyed by clinical surveyors, and the change really is that the life safety surveyors will be physically going out now to look at those.
Absolutely.
So appreciate that. Back to you, Herman. Okay, Herman, this is a specific one. We'll see where it goes. So EC 020101 EP7 required the hospital to identify individuals entering its facility, period. This requirement seems, according to the Joint Commission crosswalk, seems to has been deleted. Does that sound accurate to you? Do you have any insight on that?
Yeah. So while the specificity, that language is, has been removed, there's still a requirement to maintain a safe physical environment. And so I would imagine if there was a scenario that a surveyor found, they would score it against National Performance Goal 1111 EP1, because that's where all the security related evaluations are scored.
Appreciate it. Good example of moved from specificity to big umbrella, but it's still there. You still have that requirement. Appreciate that. Colin, I'm going to go back to you and have a question. Where have the requirements for managing risks for construction projects ended up?
So there's a couple of mentions of it sprinkled throughout the standards, but specifically PE 030201. It outlines all of the same EPs that the previous or current standards identify. So are you doing staff training? Are you doing a fire watch where it's necessary? Are you doing additional drills, additional firefighting equipment, all those things? The same EP bullets, it's just in a different section.
Terrific. Thank you. I want to jump in and make sure we cover at least one more. Paul, I'm going to lean this to you, and it's pretty specific, so it's good that we get this out in the open and clarify this. It says, am I to understand that hospitals can use newer editions of Life Safety Code other than 2012? Can you just explain the state requirements and what they are versus CMS and where it still lands?
Yeah, I'm glad you asked that one, Nick. I was trying to type into it, but I'm having issues with my text for some reason. I can't respond. But anyways, I want to make sure that it's crystal clear based off the comment that I gave about the definition for gross square foot. Please know that that doesn't mean you can use any edition of the Life Safety Code. In cases where there's something in the 2012 Life Safety Code that is not crystal clear, it's ambiguous, and it might have been clarified in a more current edition, you might be able to use that specific piece because you're not going above and beyond. It was just simply clarified in a later edition of the Life Safety Code. And we have had AHJs allow that specifically for this piece that we're talking about with the gross square foot area. So please, please, please don't misinterpret it as Paul said we can use any edition of the Life Safety Code that we want. We still need to use 2012. Thank you.
Appreciate it. And then actually the last one I'm going to send to you, Herman, and then I'm going to wrap it up. And maybe the general question I've been getting in a couple different ways here is, do you have any sense of what the Joint Commission's temperance is going to be for this change? As people get surveyed in January and February of next year, do they have to have all their verbiage all corrected and wrapped it up in a bow, or what is that? What do you anticipate that's going to look like?
Sure. So, good. So one of the things I think all the speakers have touched upon is that there's not a whole lot of change, right? There's been a removal of some requirements, and I called out the management plans, but there's not a whole lot of change. So if you've been compliant, and one of our speakers said, this is not a one-day thing. If you've been compliant, you should be compliant. Now, there's some rearrangements on things, and you have to go by the survey process guide, and I imagine it's going to be a learning process for all involved, right? But in terms of leeway, I expect, the Joint Commission is very collegial. The Joint Commission surveyors, I've worked with them, with the field directors. I have a great relationship with them. They are not out to play gotcha. It's about education, but it's also about accountability. So, I would not, let me go back to this, and I'm going to be very comfortable and stressing. If you've been compliant, you should be compliant. There's no expectations that there's going to play gotcha or alter the survey process to be more punitive. So I hope you feel more comfortable by hearing this presentation and for my response to that question specifically.
Nah, I appreciate it. That was a great way to wrap this up, Herman. And really, we appreciate you being here. Paul, Colin, thank you very much. Thank you all for joining us today. We'll be reaching out with a recording and resources, as we mentioned. If you're interested in learning more about our compliance services, visit our website at www.jensenhughes.com/healthcare. Feel free to reach out directly to Paul Zrinda with any technical questions. He'll continue to collate those. We will collect all the questions that we have and put them out in a Q&A in the next week or so. Appreciate your time. Everybody, have a great rest of your day.